Hello, welcome to the introduction to the impact of COVID-19 on children and young people in the context of domestic abuse. My name is Yvette Corey-Bent, and by way of background, I've got a long back history of working in frontline provision with survivors of domestic abuse, including children, and I currently work as part of the training team at Equation. Equation exists for the purpose of reducing the harm that domestic abuse does within communities, and our whole school approach aims to tackle the cause of domestic abuse by delivering domestic abuse awareness and healthy relationships projects in primary and secondary schools, and we aim to reduce the harm by running campaigns and delivering training to professionals throughout the year. The only crisis intervention work we undertake is the work with men, so male survivors. So we work with men experiencing high risk, medium risk and standard risk forms of domestic abuse. Equation is a charity, and like many other charities in this climate, we're dependent on fundraising. So if anybody would like to get involved, please do get in touch. So this is an introduction to the group agreements that we use at the start of our projects for children and young people to ensure that they learn about relationships in a safe way. I would ask you to observe the agreement in terms of taking care of yourself throughout the briefing today, as we know that domestic abuse is incredibly prevalent. So we're going to look at the definition and set the context for the briefing. So the definition of domestic abuse was updated in 2013 to include any incident or pattern of incidents of controlling, coercive or threatening behaviour, violence or abuse between those aged 16 or over who are or have been intimate partners or family members regardless of gender or sexuality. This can encompass but is not limited to the following types of abuse. So it can include psychological, physical, sexual, financial and emotional abuse. Second part of the definition includes controlling behaviour. So it is a range of acts designed to make a person subordinate and or dependent by isolating them from source of support, exploiting their resources and capacities for personal gain, depriving them of the means needed for independence, resistance and escape, and regulating their everyday behaviour. Coercive behaviour is an act or a pattern of acts of assaults, threats, humiliation and intimidation or other abuse that is used to harm, punish or frighten their victim. And this definition includes so-called honour-based violence, female genital mutilation and forced marriage, and is clear that victims are not confined to one gender or ethnic group. So this is just to highlight that we have a new domestic abuse bill going through Parliament, and the length of time it's taken to pass through Parliament has been impacted by COVID-19. So its purpose is to create a statutory definition of domestic abuse, emphasising that domestic abuse is not just physical violence, but can also be emotional and coercive control. It also recognises that children are victims of domestic violence and abuse too. And it will look at changing language to recognise economic abuse rather than just financial abuse. So we know that economic abuse, it may include, for example, preventing the victim from accessing employment or damaging the victim's possessions. So it really expands that definition of financial abuse to think about economic abuse. So COVID-19 in the context of domestic abuse. So just to set the local and national context, so the National Domestic Abuse Helpline has seen a 25% increase in calls and online requests for help since the lockdown. And we know that the increase started at the beginning of the lockdown. An initial survivor survey carried out by Women's Aid in April 2020 confirmed that COVID-19 had impacted on the experiences of women experiencing domestic abuse. So 67.4% of survivors who were currently experiencing abuse said that it had got worse since COVID-19. 76.1% said that they were having to spend more time with their abuser, and 71.7% of survivors who were experiencing current abuse stated that their abuser had more control over their lives since COVID-19. So examples of this in terms of how the perpetrator may use coercive control in the context of Covid-19. So emphasising that they shouldn't be going out. So really instilling fear into the survivor about leaving the house, which obviously then gives the perpetrator more control, power and control over the survivor. Not allowing access to medication or medical interventions. And we know that for some survivors, domestic abuse is aligned with trauma. And so therefore there is an increased risk of a survivor experiencing mental health issues. And if they're dependent on medication to help them function throughout the day, if the perpetrator is withholding that medication, then, you know, how does the survivor actually function? And then how does the perpetrator exploit that situation? Minimising or stopping them from being able to access their support networks, which could have included places no longer open, such as schools, children's centres or local shops. And we know that for some survivors, obviously accessing their local shops and accessing schools and other support networks can often be a lifeline for them. So just to give you a local picture then, Juno Women's Aid in Nottingham have recorded a 120% increase in calls on the 23rd of August 2020 compared with the same date in 2019. So this is a profound increase in calls, and the increase, as I said before, started almost immediately at the start of lockdown. So COVID-19 and domestic abuse, so how has it impacted on children? So children and young people, the key impacts identified. Reduced access to support networks, so not being able to access their usual routes through to support, including schools, children's centres, youth centres, and of course not being able to access friends has had a huge impact on the lives of children. Lockdown bringing domestic abuse into sharp focus, so children will develop coping strategies such as spending time away from home for periods of time to escape domestic abuse. So not being able to escape has really brought it into sharp focus for some young people. Making it harder to speak out, so just not having access to anybody to be able to speak to. Making it more difficult to leave the situation due to restrictions. And then drinking during lockdown. So we know that drinking during lockdown generally increased across households. So if there has been a misuse of alcohol, we need to consider how this may have impacted on children and take into account that alcohol is a risk indicator. Exploiting fears about the coronavirus, so instilling more fear than necessary in children as part of the control within the household. And then young people worried about other family members. So children will learn how to protect themselves, but also other family members, such as younger siblings, and may even be worried about family members living outside of their home. So this is a child's voice, a girl aged 16, and she was calling out to the NSPCC. I want to be there for my granddad, but because of the lockdown, I am unable to visit him. My grandma is very controlling and she won't let him use the internet or a mobile phone, and all of his money gets paid into her account. The whole family know what grandma is doing, but they're too afraid to tell on her. Since the lockdown, I'm becoming increasingly worried for his safety and I feel so sick. Please can you let me know what I can do to help? So I think this is a really powerful statement about just how worried some children are about their relatives. So mental health and well-being. So we need to think about the mental health and well-being of young people. We know that for some children and young people, domestic abuse is aligned with trauma, and the impact of domestic abuse on children will depend on many factors such as their age, their stage of development, their position within the family and their support networks. The children and young people will have had losses of or reduced opportunities to support networks such as family, friends and professionals. So this is another child's voice, a girl aged 15. My CAMHS appointments are now online, but it's not the same. I don't feel like I can talk to anyone. So we shouldn't take for granted that everybody is comfortable working remotely, and certainly for some young people, they find it incredibly difficult to connect with others online and say it's just not the same. So key considerations for schools. So children and young people may have challenges with transitioning back into school. So children that have been away from school for a long period of time might find it really difficult to actually go back to school, and it can be quite a daunting process for them, especially for young people who have had COVID-19 fears instilled into them. It might be, you know, a very anxious time for them actually to go back and have contact with other people. Unhealthy coping strategies. So we know that when children are exposed to domestic abuse, they often develop coping strategies, and we need to find out what those coping strategies are. And if they are using unhealthy coping strategies, then we need to move them towards developing healthy coping strategies. Poor self-regulation. So some children will find it very difficult to regulate themselves and not be able to understand how they're feeling. So again, we need to support children to identify those feelings and work towards helping them to better regulate themselves. Relationships with peers, staff and family may have suffered as a result of obviously social distancing, but also being cut off from people as well. Disclosing their experience of domestic abuse. So when children obviously go back to school, they may feel safe enough to disclose their experience of domestic abuse. The most fundamental thing that we can do for children is listen to what that experience is and respond appropriately. So how to support children and young people then? So provide opportunities and safe spaces in school for children and young people to talk about their experiences of lockdown. And I'm sure that, you know, children will have a lot to talk about when they get back to school. Support opportunities for children and young people to reconnect and rebuild friendships and relationships, because some of those relationships, you know, would have become very distant for young people. So thinking about ways to bring them back together and really rebuilding those friendships. Listen to feedback from pupils. As I said before, the most fundamental thing that we can do for children is listen, recognise and respond to concerns. So remember referral pathways to specialised support. The best way of responding to children and young people is to follow integrated coordinated pathways and refresh your domestic abuse training. We do offer lots of training at Equation, and we have turned many of our training sessions into remote training courses so that you can access them online. Use trauma-informed approaches to working with children and young people experiencing domestic violence and abuse, and we know that trauma-informed care is now the preferred way of delivering support to survivors, and we know that trauma-informed care can really encourage recovery. Utilise Equation support booklets for children and young people, plus other organisations' resources, and we have put a link in the PowerPoint so that you can have a look at our resources, and I will go through them before the end of the briefing. Book Equation's healthy relationship and domestic abuse awareness projects and sessions, and I know that many of you have already started booking in our work already. So just in terms of support services and resources, so Juno Women's Aid, so that is a local women's aid group, and they cover Nottingham City and County. They provide information and advice to adult survivors and child survivors. They provide drop-ins and one-to-one support, healthy relationship courses and therapeutic groups, particularly around rebuilding relationships between parents and children. They provide refuge, emergency accommodation, foster care for family pets, in recognition of the fact that some families don't want to leave the abusive relationship through fear of leaving their pets behind, particularly when they're scared of the perpetrator harming the pets. And then Juno Women's Aid also provides the Teen Advocate Service. So that's supporting young people who are experiencing domestic abuse within their own intimate relationships. So Nottinghamshire Women's Aid, they cover Nottinghamshire North County. They're very similar to Juno Women's Aid. They offer domestic abuse support services, intervention and recovery services, children and young people domestic abuse services, so working with children on a one-to-one basis, with those children that have experienced domestic abuse within the family setting. They provide independent domestic violence advocate services, so working with survivors of domestic violence and abuse who have experienced high-risk forms of abuse. They offer refuge support services, and supporting women and young children and children on an outreach basis at the FAR Centre. They also offer counselling services as well for adults. Many of you will be aware of the NSPCC, so they offer advice and support for parents and carers, information for anybody worried about a child, and then you will be familiar with Childline, which is a brilliant opportunity for children to get information and support, and particularly for children who have been worried about Covid-19 or other issues. Some of you are fortunate to have a place to be located within your school, so they offer mental health support services for schools. They can support children with issues around returning to school, so they've got lots of resources, and they also provide support for parents. So equation support resources. So I'll just quickly give you a brief introduction to each booklet. So the booklet for me, so that is aimed at children in primary school, and it's targeted at children that have been identified as experiencing domestic abuse. And it's a really easy book to use. It's got lots of guide to use, and it looks at raising awareness about what domestic abuse is, but also where to get help and support. It's very creative, so there's lots of creative activities for children to get involved in. The book for me, that is designed for children in secondary schools, and it's very similar to the booklet for me, and it's targeted at older children. The Moving Forward booklet, that was designed to support young women who are experiencing domestic abuse within their own romantic relationship. And then we've got the Self-Esteem booklet for girls and the Self-Esteem Choose Your Life booklet for boys. So if you are interested, do contact Equation and you can get copies of our resource booklets. So we are at the end of the briefing. So for further information, please refer to Equation's website. Thank you.